So by popular demand, folks are wanting to know why they may be gaining weight on testosterone. And by gaining weight, I don't mean like gaining muscle weight, because of course when you go on testosterone for masculinizing therapy, especially if it's full masculinizing therapy, not non-binary and such, then over the course of a couple of years, you can gain up to 25-30% muscle mass. Not bad weight to be gaining, right? But a lot of people may notice that they're gaining fatty tissue weight. So why is this? What could maybe be causing it? And maybe you could do something to avoid it or fix it or whatever. So let's look into that, and I'll get my handy dandy magnifying glass. Oh God, yeah, this sucks. $3 and you can't see crap through it. Anyways, so let's investigate. So first of all, why would someone be potentially gaining weight after they've started testosterone? So one of the main reasons is going to be estrogen. Interesting, right? So all estrogen used to be testosterone. Whether you were assigned female at birth, assigned male at birth, all of your estrogen, whether it be estradiol, estrone, estriol, whatever kind of estrogen, it started off as an androgen, a masculine hormone, testosterone. Pretty neat, right? Anyways, so what does that have to do with anything? Okay, so estrogens like to get stored in fatty tissue, and fatty tissue itself has this fun stuff called aromatase. So aromatase is what is responsible for taking testosterone, converting it into an estrogen. So the more fatty tissue you have on your body, then the more possibility, doesn't mean you will, but the more possibility that you will have higher levels of estrogen and higher levels of testosterone getting converted into estrogen, because you have more aromatase in the body. So here's the thing. So you go and you inject your testosterone, or you put it on as a patch or whatever. Most common form of testosterone administration is going to be injection, so I'll probably be saying that a lot. So you go and you inject your testosterone. Well, whenever you're first done with injecting, that first 24 to 48 hours, that's going to be going up and hitting your peak level of your T. Well, whenever T levels peak in the body, depending on where they are, what your dose is, blah, 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 everybody's different, your body may see that going up and decide, oh, hey, let's convert some of this into estrogen to help control the rise of testosterone. Anywho, so some of that gets converted. So people who DIY and they do too high of a dose, they could end up converting an awful lot of their T into E as well, which can be problematic, you can imagine. But anyway, everybody has a different set point of when their body might be converting testosterone into estrogen, and it will convert it like all the time, no matter what, because the body does need some degree of estrogen for bone and brain health and all this other crap. Woohoo! But anyway, so the more fatty tissue you have, the more aromatase you have, and so therefore the more chance that you have for converting testosterone into some estrogens, and estrogens like to be stored in fatty tissue, and da-da-da-da-da. So, if you followed that, I know it's a bunch of words, then you could either, hold on, follow me here. You could either be on a dose that is too high for your body's set point of testosterone use. Meaning, like, let's say your body, just for whatever reason, once it hits a T level of 600, after that's when it says, we need to convert some of this excess that's over 600 into estrogen. Other people, it might be 1000 of T that they start converting. It's different for everybody. So that's one piece to the puzzle. It may be that you need to just back off slightly and you'll stop producing as much estrogen out of your testosterone that then gets stored in fat and breeds more fat and all this stuff. It's like, clearly I have an issue with this as well, and I don't even inject testosterone. But anyway, I'm like a big pool of stored estrogen apparently. Anywho, so it could be that your testosterone dose is a little bit higher than what your body's set point is for when it decides to convert testosterone into estrogen. It could be the type of injection that you're doing as well. So when you inject testosterone, there are two different kinds that you can do. You can do intramuscular, which intramuscular goes into muscle. That's the more traditional. There's also subcutaneous injections where you inject with a shorter, thinner needle into some fatty tissue in the subcutaneous layer. When you do that, you do have a slightly higher chance then of converting some of that T into E because you're injecting it directly into the tissue that has that aromatase. Ta-da! So that doesn't mean that it necessarily will, but if you are doing subcutaneous testosterone injections and you notice that you didn't have any change in lifestyle habits, eating, and whatever, but you've been steadily gaining fatty tissue weight, you might want to explore that. It's less common for that to happen on intramuscular injections, but clearly it can if your levels are going up above your set point to where they convert more into estrogen and store in the fatty tissue and all that. But with subcutaneous tissue type injections, that's a definite possibility. Another is like if you have testosterone patches, you should definitely be applying them over a layer of skin that has like muscle tissue underneath it. So if you have good muscular arms, or reasonably, muscular arms, like not like mine that have a bunch of fatty tissue up top, then you could put it there. Some people put it like on their shoulder blade or on their outer thigh or something like that. But if you put those patches over a significant layer of fatty tissue, the same thing can happen as if you inject into that fatty tissue. So the testosterone is being absorbed into the tissue below it, and if there's a lot of fatty tissue, then there's a lot of aromatase available, and therefore it increases the chances of converting your testosterone into estrogen, which can then cause some more fatty tissue storage and all this stuff. Anyways, so the same thing can happen with the gel or the cream. If you're applying the gel or cream to an area that has a lot of fatty tissue rather than muscle tissue underneath it, the incidence of converting T into E, again, a little bit higher. So this is something that a lot of people deal with testosterone. And even if you do everything right, like if you get on whatever, you're putting it on a muscular area, or you're injecting into a muscle to decrease the chance of it coming into contact with more aromatase than it has to, and your levels are, within a good, reasonable, normal range, and it doesn't seem like, they really should be getting up high enough on the dose that you're on to be able to convert. Even with all that, you can still see some weight gain. And one of the best ways to combat this, nobody likes to hear it, but strength training. You gotta exercise. I know, I tell myself that every day. You gotta exercise, Stacy, and here I am making videos. But anyway, it really is the best way to proactively combat the weight gain that can be seen with testosterone. And I'm not talking like go crazy. I'm just talking about like strength training, like 30 minutes, 3 times a week. Just use that T, like put it to use. Like the more active you are while on T, the more benefit you'll see to the whole muscle gain thing. Remember at the beginning of the video, I mentioned that you can go upwards of 25-30% muscle mass gain over the first few years. You will maximize your potential of that muscle gain if you are working out, especially with strength training during these first few years. You can really see that maximized. So I highly recommend that to anyone who's getting on testosterone, because it's going to not only increase your muscle mass, but it's going to help shape your body in a more masculine physique over time as well. It will help with that whole fat redistribution on the body, get rid of those hips, all that good stuff, right? So definitely something to consider. There are some specialty labs and stuff that can be run if, like, let's say you're doing all the right things, you're working out, you're on, intramuscular injections, and your levels are not going, overly high, and all this stuff. You're doing all the things, and you're still gaining fatty tissue and stuff, and your diet's on point and all that. Anyways, there are some specialty labs that can be run to kind of check and see if maybe you have an issue somewhere along there, and like I would check and see which kind of estrogen you might be converting into. And then like check some stuff like your sex hormone binding globulin, albumin, your total and, free testosterones, and, so if you have a good provider that can kind of look at these things and kind of see if there's some other thing going on picture-wise. Maybe you're getting a little bit more insulin resistant or something like that that creates this whole vicious cycle and everything. Anyways, have a good healthcare provider, discuss it with them, see if there's some stuff they can run to see since you're doing all the other things. Because I mean, most of the time it's going to be these other things like the activity level or the testosterone level itself or the method that you're using, like subcutaneous injections or applying the gel or the patches over a fatty tissue area or something like that. Most of the time it's going to be those things that are causing this fatty tissue increase, not something, you know, that's off on your labs and whatnot that could be preventing. I mean, I know that'd be a nice excuse. Oh, well, you know, I don't need to work out because, all my stuff on my labs is messed up. There's just no hope. Like, no, that's not going to be it. That's going to be probably like less than 5% of people are going to be having the problem because of that. So anyways, hopefully this was helpful. I can't really think of anything else I might want to go into because I just don't want to make another like 25-minute long video that people are like, God, Stacey, you're just droning on. But the end of the video here, just a summary. So being on testosterone therapy, you can gain some fatty tissue. Usually it's going to be because of the testosterone aromatizing, because of aromatase, so changing into estrogen, various forms of it, and the estrogen loves to collect fatty tissue, and it's even stored in fatty tissue, and so, you know, a nice little cycle of putting on some fatty tissue. Anyways, so testosterone converts into estrogen, you start gaining weight and everything. This can be from various sources, either from your injection type, such as subcutaneous injections, where you're putting it into the fatty tissue where the most aromatase is, or applying creams or gels or patches over a fatty tissue area rather than a more muscle-containing area. It could be that you are highly sedentary and you get on testosterone. I can tell you, like, if you're highly sedentary and you get on T, you will probably gain a lot of weight anyway, because if you're sedentary, you probably are going to have like a lot of aromatase producing fatty tissue. Anyway, and then you'll be at higher risk for conversion into estrogen, which again, you know, fatty tissue deposition and all that stuff. So you can change up the method that you're using, or the place that you're applying it or injecting it. You can change your activity level, which, like I said, I highly recommend that anyway when someone goes on testosterone, even if it's just a minimal 30 minutes 3 times a week of strength training, because you're going to maximize your benefits of being on testosterone and getting muscle mass increase, as well as the whole fat redistribution body shape pattern whenever you do that. Anyway, and then if you do all the things right and you're still struggling there, then check with your healthcare provider and see if maybe there's something else going on in there that might need to be looked at as to why you are steadily gaining weight even though you're doing all the right things. So hope this was informative. If you have any other good hormone questions out there, just let me know. This was a good one thrown at me. See y'all later.